started seeing people here, I kind of had a mental image of who I was going to see. Kind of a homeless person pushing a shopping cart with all his earthly belongings in it. We very rarely see what you would call a homeless person. And it's not the destitute and the guy living under the bridge, it's your neighbor.
Actually, as someone who accepts donations from patients, it is so difficult to accept a donation from someone when you watch them pull the last $2 out of their wallet. But they want to do it because they want to give something. They want to contribute. You watch patients in the waiting room and they see, you know, a mom with a kid who's clearly sicker than they are, and there's a limited number of slots, and some adult will give up their slot for the mom with the kid so that that person can be seen that day. And, you know, it's just a wonderful, incredible environment.
And we have, as you can see from the list behind me, all kinds of specialty care, not just one doctor looking at sprained ankles, but we do diabetes education and vision and immunization for kids so they can go to school, plus all the sprains and ankles and colds and sore throats and whatnot. So we've morphed over 20 years from kind of a shoebox operation to now one of the biggest free clinics in the state of Washington.
Providing dental care, I mainly see adults that are in need of urgent care who have been in pain for sometimes for 6 months or a year, and they have no insurance. Sometimes they've had to go to the emergency room, and just to be able to provide relief for that pain, plus not only that it helps their oral health, but additionally it affects their entire body. And I feel that I give a little bit, but I get so much back, more back from the patients that I'm giving. It's very rewarding.
In my experience, I usually tell my family I have to go to work, but when I have picked up a shift at the free clinic, I always say I get to work at the free clinic tonight. And that really is how I feel, because you do get so much back from the patients. I know with diabetes care that the patients often feel, they feel like they're out there dying. When they come here, they get hope.
But it still costs money. Our medicines are not free, all the x-rays we have to pay for, CAT scans. So we don't, all of our funding really needs to come from private individuals or companies or organizations that will donate money to us.
I just cannot imagine there not being a need for the free clinic in the future. I think it'll be greater than ever with the complexity of people trying to figure out how do they get care, and you know, you just have to come on a night when the line wraps all the way around the building in the pouring rain for people waiting to get in to be seen because they couldn't be seen anywhere else.
And I see people on the way out that have been through the whole process, and I can't tell you how many times I've heard, "Thank you for being here. I'm just so grateful. I don't know what I would have done." And I'm proud to be a part of that. If it's selfish, you know, that's okay, I think, you know, because it is pride. You feel good. If they feel good on the way out, we're all going to feel good about the job we did.
It takes a team to do this. It really takes a team, and a team that works well together. And I feel that the free clinic works well together. From the front desk to the very end, everyone is appreciated.
There's a lot of sad stories that we see when we're working here, but what's amazing to me with the staff this clinic has, everybody's working together, everybody likes each other, they socialize. I get out of this place, I'm walking out of here with a smile and a buzz because I feel that good.
Yeah. Mm-hmm. Mm-hmm. There'll always be people that fall through the cracks, and that's really why we're here.
You know, and even though we don't talk about it, the sense of humor here is so important, so good. A few weeks ago, I was working, I got this prescription, and I couldn't read it, so I took it off to the physician. I knew who the physician was, and he says to me, "What can't you read?" And I said, it's your signature. I says, can you write it down on a special card for us? Because we keep that in the pharmacy so people, we can identify who it is. But the fact that it is, the physician had a good laugh with me, and it's such an enjoyable atmosphere that you can do that.
Yeah.
You feel safe here.
Yes, definitely.